Our bodies are incredibly complex systems, working tirelessly every moment of every day to keep us going. We often think about our heart, our lungs, or our brain as the main players in our health story. But behind the scenes, there is a powerful network of chemical messengers quietly directing the entire show. These messengers are called hormones. They are the silent conductors of our body's orchestra, ensuring that every instrument plays in harmony. Understanding their role is the first step toward taking better control of your overall well-being and ensuring your body functions at its best for years to come. It's a crucial part of your health you may not be thinking about. So, what exactly are hormones? You can think of them as tiny messengers, like text messages, that are sent from one part of your body to another through your bloodstream. These messages are created by special glands, which together form your endocrine system. This system includes glands like the thyroid, adrenal glands, and pancreas, among others. Each gland produces specific hormones that carry instructions to different organs and tissues, telling them what to do, when to do it, and for how long. It is a highly sophisticated communication network that controls countless functions, from your growth as a child to your energy levels this afternoon. Many people mistakenly believe that hormones are primarily a concern for women, particularly during life stages like menopause. However, this is a significant misunderstanding. Hormones are absolutely essential for everyone, regardless of age or gender. Men, women, and even children rely on a delicate balance of these chemical signals for their health. For men, testosterone is a key hormone that influences muscle mass, bone density, and mood. For everyone, hormones like insulin, cortisol, and thyroid hormones are critical for managing blood sugar, stress, and metabolism. They are universal players in our health. This intricate hormonal balance is what allows our bodies to function optimally. When all your hormones are at the right levels, you feel energetic, your mood is stable, and your body can efficiently handle daily tasks. It's like a finely tuned engine running smoothly and powerfully. This balance supports everything from getting a good night's sleep to maintaining a healthy weight and having a strong immune system. But when even one of these crucial messengers is too high or too low, the entire system can be thrown off kilter, leading to noticeable changes in how you feel and function in your everyday life. When your hormones are out of sync, your body has ways of letting you know. It sends out signals that something isn't quite right. These signals can often be subtle at first, and we might dismiss them as just a part of aging or a consequence of a busy, stressful life. One of the most common signs is persistent fatigue. This isn't just feeling a little tired after a long day. It's a deep, lasting exhaustion that doesn't seem to improve even with plenty of rest. If you constantly feel like you're running on empty, it could be your body's way of signaling a hormonal issue, such as an underactive thyroid. Another major indicator of a potential hormonal imbalance is unexplained changes in your weight. You might find yourself gaining weight despite eating a healthy diet and exercising regularly. Or, conversely, you might be losing weight without trying. These fluctuations can be incredibly frustrating. Hormones like insulin and cortisol play a direct role in how your body stores fat and uses energy. When they are not balanced correctly, your metabolism can slow down or speed up, making it very difficult to maintain a stable weight. It's a sign that your body's internal management system needs a checkup. Our emotional state is also deeply connected to our hormonal health. If you experience frequent mood swings, increased anxiety, or feelings of irritability for no apparent reason, hormones could be the culprit. For women, these changes are often linked to the menstrual cycle or menopause, but men can also experience mood shifts due to changes in testosterone levels. Cortisol, the stress hormone, can also have a profound impact. When it's chronically elevated due to long-term stress, it can lead to feelings of being overwhelmed, anxious, or even depressed, affecting your relationships and quality of life. Beyond fatigue, weight changes, and mood, there are other physical signs to watch for. You might notice changes in your skin, such as persistent acne or unusual dryness. Some people experience hair loss or thinning, while others might see changes in their sleep patterns, like insomnia or waking up frequently during the night. A decreased interest in activities you once enjoyed, including a low libido, can also be a sign. These symptoms are your body's way of waving a red flag, telling you it's time to pay closer attention and investigate what might be going on beneath the surface. Ignoring these persistent symptoms is never a good idea. While it's tempting to hope they will just go away on their own, doing so can allow a small, manageable issue to grow into a more significant health problem. Chronic hormonal imbalances can increase your risk for long-term conditions like heart disease, osteoporosis, and diabetes. They can erode your quality of life, making it difficult to work, socialize, and enjoy your daily activities. Think of it like an engine warning light in your car. You wouldn't just ignore it and keep driving. You would take it to a mechanic to find out what's wrong before a major breakdown occurs. Your primary care doctor is your best partner in this process. They are like a health detective. When you share your symptoms, you are giving them the first set of clues. They will listen carefully to your experiences, asking questions about your lifestyle, diet, stress levels, and family history. This conversation is the essential starting point. Based on what you describe, your doctor can begin to piece together the puzzle. They can determine if your symptoms point toward a potential hormonal issue or something else entirely. This initial consultation is a critical step toward getting the answers and the help you need. If your doctor suspects a hormonal imbalance, they won't just guess. They have specific tools to get a clear picture of what's happening inside your body. The most common tool is a simple blood test. This test can measure the levels of various hormones, such as thyroid hormones, testosterone, estrogen, and cortisol. Seeing these numbers gives your doctor concrete data to work with. It tells them precisely which hormones are too high or too low, confirming whether an imbalance is the root cause of your symptoms. These tests are safe, straightforward, and provide invaluable information for an accurate diagnosis. Once your doctor has the test results, they can create a personalized plan just for you. This plan may not always involve medication. Sometimes the solution can be lifestyle adjustments. Your doctor might offer advice on nutrition, exercise routines, or stress management techniques that can naturally help rebalance your hormones. If treatment is needed, they can explain the different options available, such as hormone replacement therapy or other medications. They will discuss the benefits and any potential risks, ensuring you can make an informed decision about your health. A doctor's guidance is key to finding a safe and effective solution. It is completely normal and, in fact, very smart to ask your doctor about your hormones. For too long, these conversations have been surrounded by stigma or misinformation, especially for concerns related to aging or sexual health. But your hormonal health is a fundamental part of your overall health. There is no reason to feel embarrassed or hesitant to bring up your symptoms. Doctors are trained to handle these topics with professionalism and care. They hear these concerns from patients every single day. Speaking up is not a sign of weakness. It is a sign that you are taking an active and responsible role in managing your own health. To have the most productive conversation, it helps to be prepared. Before your appointment, take some time to write down your symptoms. Note when they started, how often they occur, and how they are affecting your daily life. Are you more tired in the morning or the afternoon? Have you noticed changes in your appetite? Are you feeling more anxious than usual? The more specific details you can provide, the better your doctor will be able to understand the situation. This simple act of preparation can make the conversation more focused and ensure that none of your important concerns are forgotten. Remember, your doctor is on your team. Their goal is to help you feel your best. Be open and honest during your discussion. Don't downplay your symptoms or feel like you are complaining. What you are experiencing is real, and it deserves to be addressed. A good doctor will listen without judgment and work with you to find a solution. If for any reason you feel that your concerns are not being taken seriously, you always have the right to seek a second opinion. You are the most important advocate for your own health, and finding a healthcare provider you trust is essential. Ultimately, checking in on your hormones is a powerful step toward living a healthier and more vibrant life. It's about more than just fixing a problem. It's about optimizing your well-being. By addressing imbalances, you can regain your energy, stabilize your mood, and feel more like yourself again. Taking charge of your hormonal health empowers you to not just live longer, but to live better. So, start that conversation. Ask those questions. It could be the game-changing decision that helps you feel healthier and happier for many years to come, allowing you to take center stage in your own life.